If you or your child are experiencing spasticity in the leg, give these gentle exercises a try that work better than stretching.
Now, of course, always consult with your medical provider before starting any new exercise program. I'm Jen, an Anat Baniel Method Practitioner, and I help adults and children with a disability learn to move better by accessing the power of their brain instead of just using muscle strength alone. Okay, so I've got my baby and my skeleton here, and I'm just going to notice, how is my child lying? How are their legs configured? You can see with the doll, she's got lots of gaps in between her knees. So I'm just going to fill that in with something comfortable, maybe a pillow or a rolled up towel, just to make sure she's the most comfortable. So the first step is to make sure your child is comfortable. The second step is to just observe where their leg naturally lies. Now I'm going to imagine that my baby has spasticity in her left leg here. So often it's rotated inwards with the foot rotated inwards as well. So I'm just going to imagine that that's what my doll is doing here. I'm going to use my hands like a soft, gentle cloud that can support her brain in what it's already doing. So I'm just sliding my hands underneath her knee, and I'm matching the rotation that her leg is naturally taking. So if this was on the skeleton here and his leg was rotated inwards like this, I'm going to use my soft, gentle hands to slip underneath that knee gap right here. And I'm just going to support it in what it's doing. Notice I'm not bringing it, I'm not forcing it back to the midline, past the midline. I'm actually just going to hang out with him right where he's the most comfortable, in this position here. And then I'm going to go with his system. So I'm going to actually roll his leg a little bit more inwards and then back to his own midline where he's the most comfortable. So I'm going to roll him a little bit inwards and then back. I'm going to go nice and slow, just like you did on yourself. So what it would look like on the doll here, I'm going to support underneath her knee, make sure her knee is nice and comfortable, supporting hands, and I'm just going to roll a little bit inwards and back to where she's most comfortable. A little bit in and back to where she's most comfortable. So do that a few times and just feel and notice, where is her leg moving? Is her pelvis moving? Is her hip moving with the movement? It might and it might not. It just depends. I'm going to go nice and slow. And then we're going to actually add in that variation of the hip going with the movement. Now imagine the pelvis like a ball that can roll in 3 dimensions. So just like this ball can roll like this, I'm going to imagine her pelvis can roll like a ball as well, like this. Or here, I'll show you on the skeleton, his pelvis can roll like a ball like this. And have one hand underneath the knee that has spasticity in it. The other hand, I'm just going to place it underneath the hip bone like this, underneath the pelvis. And as I roll the leg inwards like this, going with the spasticity, I'm going to gently just roll the pelvis along for the ride. And then back down to where they're the most comfortable. So roll the leg a little bit and bring the pelvis along for a ride, and then back down. I'll show you on the skeleton. I'm going to slide my hand underneath the knee in the same position that they're the most comfortable in. My other hand goes behind the pelvis like this. I'm supporting, I'm hugging, gentle. As I roll the knee more inwards, I'm simply bringing the pelvis along and then bringing it all back down to where they're the most comfortable. So if their pelvis is like a ball here, my hand is underneath the ball. As I roll the leg inwards, I'm just bringing the pelvis or the ball along, rolling it like this, rolling it, and then back to where they're the most comfortable. Rolling the leg inwards and then back to where it's most comfortable. And then you can alternate. So I'm going to just roll the leg inwards and then back to where he's comfortable. Inwards and then back to where he's comfortable. And you can actually see movement here. The femur head is rotating inside the hip bone like this. And you can alternate that with rolling the leg and the pelvis together. So watch this joint here. I'm actually rolling it all together. So the pelvis and the leg are moving as one unit to roll the leg inwards and then back to where it's comfortable, roll the leg inwards, back to where it's comfortable, or I can alternate just rolling the leg more inwards and then back, rolling the leg more inwards and then back. This gives the brain the information that you can move your pelvis with your leg, or you can move your legs separate from your pelvis. This is quality information. This is information the brain needs to be able to come into sitting, to be able to crawl, to be able to stand and walk. It's important information for the brain to know that you can move the leg bone with the pelvis and without the pelvis. It gives the brain more options of movement to use. So if you want to learn more gentle, respectful exercises to help reduce spasticity in the legs, go check out the online program that I have made just for parents with kids with disabilities that you can do right at home. Don't forget to hit subscribe, and we'll see you in the next video.